And I'm going to ask Dr. Eckfield to talk to us about depression and what are the signs and symptoms, and is depression normal?
Thank you so much. So depression is one of the most common mental health issues among any age group, but it is often something that goes under-identified and under-treated in older adults. And I just wanted to talk to you a little bit about some of the differences in the signs and symptoms of depression in older adults compared to younger adults. When we think of depression in younger adults, we think of people being profoundly sad, maybe not being able to get out of bed, maybe losing weight, they're not eating or they're overeating. We think about people who either are sleeping all day and all night and can't get out of bed, or they're just so depressed that they can't sleep at all. They're suffering from insomnia. A lot of those symptoms are consistent across age groups. But in older adults, what we tend to find is that we don't see that profound sadness in the same way that we do in younger adults. And I think that's one of the things that we tend to think of as sort of the hallmark of depression. And when it's not there in older adults, we don't quite understand what's going on. What we often see in older adults is more of a withdrawal from their activities, a withdrawal from their families and from society. So they may not, you might ask, are you sad about things? They might not say that they're feeling sad. They just don't feel like it. They just don't feel up to it. They just don't feel, they don't get the same pleasure out of engaging in certain activities that they used to. Maybe they always loved the holidays and preparing for it. And, the past couple of years, mom or dad just really hasn't participated much in the holidays. So this withdrawal from activities that used to be really important to them is more of a sign of depression than sometimes we recognize. We also see in older adults an increase in their somatic symptoms. So they may feel physically worse. They may feel more achy. They may complain of more digestive problems. They may just not feel as good. And we don't tend to think of that right away as being related to depression. And yet that's what we're finding in older adults. It's one of the things that often comes up. And then they sometimes go to their doctors. Their doctor says, you're looking okay. We don't find anything wrong. And yet they still feel these extra aches and pains, and they don't feel like engaging in much. And those are often signs of depression. And what can we do about once we sort of suspect that maybe a friend, a family member might be slipping into more of a depression? Certainly there are some antidepressant medications that people can try, but it's not the silver bullet. What actually is the silver bullet? There's a couple, and it's going to be a repeat of what is good for the brain and what's good for the heart. Getting back engaged, social engagement, reaching out to those friends, inviting them again when they say no, to come and join you for at church, to come and join you for dinner, come and join you for a walk around the block. Social engagement and staying engaged is one of the best ways both to stave off depression and to treat the depression, helping someone re-engage and getting back into, stop withdrawing from their life, getting re-engaged in their life. The exercise piece is amazing. In people of all ages, but particularly older adults, being able to walk or get outside, do some stretches on a regular basis, preferably with a group of friends. So you've got the social engagement, you've got the social contract with other folks that you're going to meet up and you're going to do this thing together. That bit of exercise, that bit of moving around, as my colleagues have talked about, it releases different endorphins and things like that in your brain that help to improve that connection between that limbic system and the way you're thinking, and just your general outlook It's amazing that those two things, the social connection and the exercise, how much that will do, sometimes as much or even more than antidepressant medications, to help someone come out of a depression and also to stave off those symptoms of depression.